Hi, everyone. Happy Monday. This is Sarah Wagner at Chapin Hall. Thank you so much for joining us for our last quarterly webinar of the 2017-2018 academic year. I'm so happy to see so many current fellows on as well as some graduated fellows. So welcome, everyone. Really excited today for this webinar. We have a Cohort 7 policy mentor who will be facilitating this webinar. I don't want to take too much time away from our speakers, so I'm just going to say that it's been really lovely working with them, and I'm looking forward to learning from them both today. I'm going to turn things over now to Megan Branham, who's going to begin introductions.
Great. Thank you, Sarah, and good afternoon, everyone. This is Megan Branham. I'm the Director of Policy and Research with the Palmetto Association, and I'm going to be joined by my colleague, Whitney Tucker, who's the Research Director at NC Child. So, Sarah, if you don't mind going to the next slide, we'll get into introductions and then start the presentation. So just a little bit of background about us. I have a social work degree from USC and have spent my time working in policy or program from teen pregnancy prevention to maternal and child health to currently working in the child welfare space. The Palmetto Association for Children and Families is a statewide organization. We have about 50 members. Most of our members provide services for children in foster care in some way, shape, or form, and I do policy and research work for them, and I am very honored to be Oddity's mentor and very excited to have this opportunity. So I'm going to turn it over to Whitney to let her introduce herself as well.
Well, thank you so much. My name is Whitney Tucker. I have a master's degree in public health that I also got from the University of South Carolina, but I've been interested in the intersection between public health and policy for a long time. I actually got my undergraduate degree at Vanderbilt in public policy, and I've pretty much always been focused on issues that affect children and families. My undergrad research was actually focused on family planning policy work overseas, and when I finished that up and moved on to USC, got the pleasure of working with Megan at the Children's Trust of South Carolina, and that's where we really met and started working on some of the research that I'll tell you guys about today that really pushed forward this idea for me that a lot of the stuff that we look at in terms of public health, in terms of social work, in terms of, child well-being is actually really policy actionable stuff that we just have to think a little bit outside of the box to get more people involved in and engaged with.
And one thing, Whitney, of course, made me think of something that I wanted to add. So we'll probably interrupt each other a lot going through the presentation. But like you said, yeah, we have worked together for a while, and I think Whitney does have a really good perspective coming from public health and also having done some federal policy work as well. I've spent most of my time working at the state level in South Carolina, but we would really like to hear your questions and comments. We'll be getting into a little bit of the research that we've done, how we've translated that into policy practice. And like the title says, we really are looking at how do we move our work out of a classroom sort of space into the State House and into the public policy realm, and keeping the conversation moving forward to drive action. So if you have questions or comments or are curious about something, please put them in the question box or in the chat box, and Sarah will help us monitor those questions. So as they come up, please ask. We like to know. We have no issues sharing the good, the bad, and the ugly of research and policy work. So would love to talk about challenges that you're having or questions that you have in your work. So please, and we encourage you to do that as we go through. So sorry, Whitney, you can really take it over now.
No problem. No, that's actually a really good point to make. Could you go ahead and advance the slides, please? So this slide is a lot of information, but I just wanted you guys to have an overview of the project that we're going to be spending the most time talking about today. This study was published in the Global Journal of Community Psychology Practice when we were finished. It started out as something that we were interested in because Children's Trust of South Carolina is the statewide convener of the Safe Kids Advocacy Coalition in the state of South Carolina. And in terms of getting the policy outcomes that we wanted to see for child passenger safety, there hadn't been a lot of movement in several years. And we felt that with a statewide coalition of Safe Kids advocates, that more could be done to really strengthen their advocacy skill and help to make sure that their message was really reaching decision makers so that we could see changes to keep kids safer in cars and buses across the state. So the goal of our study was to first assess what Safe Kids injury prevention specialists knew, and also what our state legislators knew about what keeps kids safe, and also to assess, just for the advocates, how they engage in legislative advocacy at that current point in time, and then also what things they were comfortable with or what things they knew about that they could do to interact with legislators more in the future. Right, so we created a survey that would assess for advocates and for legislators and also legislative staff, because legislative staff are nearly as important as legislators when we're talking about getting decisions made and working with people to craft good policy. We created the survey, assessed as many advocates and legislators as we could get a hold of. You'll see there were a lot more advocates than legislators and staff assessed, but we tried to get around that by also following up with some structured interviews of legislators and staff to get some additional feedback on why we might have gotten the responses that we did, even from our really small sample. And I'll tell you more about the things that we found from that survey later. But we used that survey to then inform advocacy training for Safe Kids Coalition members that they then used later on that afternoon for an advocacy day at the South Carolina State House, where they talked to policymakers about different aspects of child safety and actually ended up getting them to pledge to introduce or co-sponsor child passenger safety legislation. So you can go ahead and advance the slides. So when we're starting out trying to figure out how to help these advocates, we started with a literature review. Most of you guys are probably very familiar with this process. This is a pretty regular way to start any form of research. We wanted to know what had already been done in this space, what people had found effective in terms of advocates being able to make their mark with policymakers, and what made people more likely to listen to them, and also what made them more likely to be better people to share that message, right? And so our research sources indicated a few major areas of interest in the project, and we broke it down into basically 3 different domains. So advocacy impact appraisals, community involvement appraisals, and then legislative persuasion tactics. And relevant questionnaire data from several different studies were kind of brought together in each of those areas and gathered for our review. And then we used that to compose the majority of the survey for advocates and staff and the legislators and legislative staff, so that we could have some questions that had already been sort of tested out in the field and known to have good results, and that weren't going to make people more confused than they were going to make people likely to fill out our survey. We altered a few of the questions to fit the audience, but they largely reflected the inquiries into the aspects of organizational advocacy effectiveness that earlier studies had already proven effective. And we moved forward with the survey by piloting it first with Children's Trust staff, and then with board of directors members at Children's Trust, and then close colleagues in the injury prevention field before we sent it out to Safe Kids advocates, because we wanted to have some quality control in there before it went out to this much larger group of folks. And when we did that, we sent it out through SurveyMonkey, and then also through paper copies, in addition to SurveyMonkey, for legislators and legislative staff, because, got to play to your audience, and some of them were, a little older, more traditional, less likely to use our electronic means than some of the Safe Kids Coalition members, who we already know are primed for using electronic communications, because that's largely how they keep in touch with each other now. Respondents were then instructed to complete the survey only once, and then to use either method. And we got, pretty good results from the Safe Kids advocates, particularly because we gathered for a period of 4 months, and we ended up, as you saw on the earlier slide, getting 174 results from advocates, and then 15 from legislators and legislative staff, which sounds low, but considering the fact that it was a legislative polling, is actually not incredibly low. A pretty exciting number of responses. and then we included in those the follow-up interviews. You can advance to the next slide. So these are the major findings of that study. First off, although advocates and legislators both considered advocates to have a greater understanding of injury prevention issues than legislators, the groups actually exhibited really similar knowledge levels when they were assessed across prevention areas. So we're talking across maybe child passenger safety and also water safety and those sort of things that you would expect advocates to have some sort of specialized knowledge in. We actually found that legislators were having similar levels of knowledge, even though legislators did think that advocates knew better than them, right? We also saw that despite the attention that both advocates and legislators and staff were giving to child passenger safety, rating it as their most important issue, both of those groups indicated very little knowledge of best practices in that area and were getting the questions consistently wrong about what is the best way to do whatever that would keep a child safe. So maybe what is the height that is the appropriate height for a child in restraint, or what age should a child or is a child currently allowed to sit in a front seat, that sort of thing. They were all getting them wrong at similar levels. For child passenger safety in particular, although everyone consistently rated that that was the issue that they felt was most salient to keeping kids safe. There were similarities in the lack of knowledge that we thought could be the outcome of ineffective advocate education or poor communication, either between advocates or between legislators themselves, because legislators are actually reported relying really heavily on each other for information, which was a finding that we thought was really important to share with the advocates when we went on to the next phase in this work, which was creating that advocacy training to then move them into the State House and use these research findings, because we're seeing that although legislators felt that advocates knew a lot about these issues, they were more likely to believe and listen to the data that they were hearing from their colleagues, right? So if you could get one colleague who was well informed by an advocate who really knew what they were talking about, then we were more likely to get legislators on board with this issue than we were to have, 50 really well informed advocates who are only there for, maybe a day or two. It was really important to be able to cultivate those sort of legislative champions. And so that was something that we had advocates really focused on when they went in for their meetings. We also saw that few advocates contacted legislators regarding injury prevention issues. So it was very unlikely that their lack of information was necessarily the result of ineffective education for advocates and the fact that they really didn't know what they were saying all the time. It's just that they actually did not have the time to reach out to them. And also that legislators had this, lack of subject matter expertise, but then a reliance on each other for information. So we thought that additional study is probably necessary to really get down to the root of, why advocates talk to legislators more about some issues than others, how legislators knew more about some issues than other issues. But overall, it was really important that we make sure that everyone started out with the same level of knowledge about all the issues that we say were important, right? And then also that they be able to have the confidence in their advocacy skills to go up to the State House and to start building relationships with legislators who can serve as champions to then reach the other legislators who are less likely to be able to get that knowledge directly from an advocate. If you could move forward, please.
Whitney, there was a question that came in about advocates. In this example, sure, or in your work in general, what are the characteristics of advocates? Like who are these people? What's their background? Does it depend on the issue that they're advocating? And how do you find them? And where do they come from? How do you engage with them? What are their characteristics?
Sure. So it depends, right? In this particular case, a group of potential advocates already existed in the Safe Kids Coalition because those people are actual employees of Safe Kids, and they were hired through a program that works to keep children safe, right? So we had a group of people who already had a vested interest in making sure that legislators were working to keep kids safe in the same way that they were, right? But in other issue areas, the group of advocates is less defined. For Safe Kids even, there were different age groups that were represented. There were different educational backgrounds, and they were in different areas of the state, right? So their interests would be in child safety overall, but they had different, local interests in child well-being that had to be taken into account. For other issues, that can sometimes mean that we end up with people who are actually interested in a range of things, right? So not just child passenger safety. They might be signed up for, say, your child advocacy network like we have here at NC Child, but then some people are interested in education advocacy, and some of them are particularly interested in issues that affect health, and then some of them have very specific interests down to things like lead abatement in homes. All right, so the way that we have found advocates most effectively is by starting with groups that work in issue area specific policy work. So sometimes we would go into a community and have public forums, and we find that there is, a parent group that is really interested in child passenger safety. So for example, in South Carolina, there was a group of moms on Facebook that had created a Facebook group because they were all so upset that they were getting fined for having their children in the back seat rear facing, even after they were technically, according to the law at that time, too old to be rear facing, despite best advice from the American Academy of Pediatrics being for their children to still be rear facing, right? Like these moms were getting fined for that. And so they created a Facebook affinity group to then complain about that issue and to organize around it. And so the way that we find people like that is sometimes online, but sometimes in person by going out and doing community forums and data walks with community groups. The other way that we find them is by actually having signups, right? So on websites, we have an advocacy listserv, and if we go to any event, we encourage people to join that just so that they can stay up to date on what's happening in terms of child well-being. And then if there's a particular issue that they're interested in, then they can click to choose certain issue areas, right, that they want to be more involved in. A lot of the times advocates really find us because people want to have a voice and they just aren't sure how to find other people who care about that issue. And so particularly in child advocacy work, I find that we don't tend to have too much trouble finding motivated folks. We tend to have a lot of trouble organizing motivated folks. But I don't know, Megan, would you agree with that?
Yeah, I was going to say, I think a lot of times it's just finding folks that are already connected to other entities, other groups like Safe Kids, like Whitney mentioned, the Facebook group, and helping organize around that. And like Whitney mentioned, we'll talk about a couple other strategies about how to reach out and engage those advocates, but never underestimate the importance of going public with an issue and with your work, because I think that's oftentimes where people see and hear about the work. So whether it's like Whitney said, those public forums, social media, putting something out, even like an op-ed, people pay attention to that, believe it or not. Oftentimes it doesn't feel that way once you put it out, but I've been surprised how many people have ended up coming to us and saying, we want to work with you on this issue. We're really interested because of a presentation that we did or an article that they read. So
yeah, so actually we ended up having a range of different recommendations that came out of our work with the Safe Kids Advocates. So the first was just really capitalizing on the strength that they are powerful in numbers. So like I was saying, this group was represented all over the state in 13 different coalitions, but they had more than 600 child passenger safety technicians who were trained particularly in how to install and tell parents and help them to learn how to install child car seats. But they weren't organized around any sort of advocacy efforts, so they hadn't been able to make really lasting change in that field. So the first thing that we advised them to do was to work on building relationships, right? So a lot of them were afraid to lobby because people feel that there is, it's kind of considered a bad word in some circles, and we really have to get away from that, right? Because even nonprofits have an acceptable level of lobbying that they are allowed to do every year, and a lot of the time organizations come in under that cap because people don't want to come off as pushy. They don't want to be seen as a lobbyist, when really lobbying is trying to get your point out, your issue out in front of people who have the power to change and make decisions around that issue. Also capitalizing on their social networks. So like we were saying, a lot of the time you can find people through community forums, social networking, especially if you have a group like this that's spread out into different localized areas. You can really use just the social capital of being in that place that might be a much smaller place than, say, a state capital, to look for new volunteers who might be interested in this issue, to look for partnership or opportunities with other groups that are already working in that area. For Safe Kids in particular, we found that a lot of people found more support by just bringing up this issue with folks they went to church with folks that they were seeing at PTA meetings, right? A lot of the time the work that we do during the day, you see people who don't necessarily work in policy day in and day out, a hesitance to really bring that work home with them. But especially if we're talking about child advocacy work, a lot of the time this work already is home with people, right? Like, it is affecting your daily life, and it is something that that you could connect more to your professional life than you could with a lot of other issue areas. So if you're working specifically on child passenger safety, there is not a day that is going to go by if you have a young child that you are not going to think about child passenger safety, because you have to put them in that car seat every single day, right? And you have to think about whether or not you're going to get fined for putting your child in the way that is technically correct, but is legally wrong, right? And so being able to talk about that with the people around you really elevates that issue, and it ends up getting in front of more policymakers, because like Megan mentioned, you have more people who feel empowered to do things like write op-eds and to share fact sheets and that sort of thing. Also, legislators live in those communities as well, right? So it's not that they're all just localized at the state capitol, and you can definitely capitalize on social networks to reach out to them when they're in home districts. We also suggest that Safe Kids advocates collaborate with other nonprofits so that they can garner greater media attention for their coalition work and increase the impact of their advocacy efforts without spending a lot more money. A lot of the time, especially in the nonprofit space, we find that there is so much limited funding for the same issue area that people are kind of competing a lot of the time to get that money so that their work can get in front of more people. But especially for an issue like this that touches so many families, there was just so much potential for Safe Kids advocates to collaborate with other community groups to get parents involved and to get, TV spots and to get more child passenger safety, like car rodeos, as they call those, and like getting legislators to come to those by just being able to share funds with other groups and collaborate with them to lift up your work. And then also training advocates more, right? So making sure that Safe Kids Coalition members actually have the knowledge that they need to be effective injury prevention advocates, because they would have to be informed advocates, right? Legislators really need for people who are coming in from the nonprofit space especially, but anywhere with a research background on an issue that they may or may not be familiar with, to be able to come to them with a certain set of knowledge that they are unlikely to get otherwise from anyone else, right? So we need advocates to be well informed when they go in front of policymakers, and then to focus on the areas that they know policymakers find important. So whenever there is a study done like ours that finds that policymakers consistently rate one type of issue area over another, like child passenger safety, right? Then we focus on child passenger safety and making sure that our advocates really know that down pat, because we know that legislators are likely to ask about it. And then Megan, can you jump in and speak about our wonderful results that came out of all this work?
Sure. Yeah, we can go to the next slide. So a little bit of context. I love being able to show this picture because it's finally the work paying off. But again, a little bit of context. So when we first started looking at this law that needed to be updated, realizing that it had been since the 80s. So, when we were realizing, gosh, the people that now are old enough to have kids that apply to this law, they were in child passenger safety restraints at the time this law was created. And just thinking about how outdated that was, that now those people have kids. And when I came to the Children's Trust in 2012, this work, there were groups that were interested in working on this. And so there was already some work being done. The article that Whitney mentioned, it was published in 2016, and obviously we had been working on it for at least a year prior to that. But we were very excited last year to be able to have that law passed. And the picture that you see is the bill signing. So Governor McMaster is the current governor in South Carolina. And I think when you look at this picture, it's important to note that there were a lot of, there were a lot of people that really were behind this. And I think if I were to give a piece of advice is that if you really don't care who gets credit in this type of work and policy work, then I think honestly, the further you'll end up going. It takes a lot of people, a lot of time, a lot of work, and not everybody is going to get due credit for the contribution that they give. But if you can recognize your piece of it and give as much in that area, and ultimately not really care if you get recognition or not, the further you'll go. It's great to have opportunities like this bill signing. Not every bill gets a bill signing, so we don't always get the big pomp and circumstance that comes with the passage of a law. But in this instance, we did. Like I said, Governor McMaster was supportive of it. The woman standing behind him in the white dress is Representative Bernstein. And Beth Bernstein was really our lead champion in this. She took this up, and as Whitney mentioned, she really was the well-informed legislator, and she talked to other legislators about this issue. She's very well respected, and she's a mom, so she used that angle of it as well. And then the people standing beside her to the left and right of her are all the advocates. So you see, obviously, Children's Trust was represented. We had someone from Safe Kids, and then we had the American of Pediatrics, the South Carolina chapter, and the Children's Hospital Collaborative, which really led this effort for the last session. You know, a lot of times it takes having a good leader, lead organization that you can trade off with. So sometimes the work requires that, you know, this is the year that we're going to lead on this issue, or you may hand it off at some point to another organization, and that's completely fine and totally normal. It does require good partners, good timing, and a variety of tactics to get to this point. But regardless of all of that, this is the end result, and we were very happy to see this passed. Any questions about this particular piece of our work? All right, then we're going to move on to the next slide. So this is, so like Whitney mentioned, both of us have since this work transitioned into other roles. And I wanted to just briefly mention a piece that we're working on with the Palmetto Association for Children and Families. So our organization is a member of Kinship Care Council that is coordinated by the Sisters of Charity Foundation of South Carolina. And they have a couple other groups that they've brought on to talk about kinship care. And when we're talking about kinship care, we're basically talking about kids that maybe have come into foster care and then are placed with a relative, a grandparent, aunt, uncle, or it's a child that maybe is at risk of going into foster care, and so they're placed with a relative caregiver in order to keep the child, you know, with family in a familiar setting and to avoid going into foster care, but the parents can receive services that they need to ensure that they have a stable household and the child will be able to grow up in that household. So we came together and started looking at this issue a couple of years ago, realized that there was a lot of really good kinship care data from other states and nationally, but there wasn't really anything in South Carolina. And it was really sort of an issue that had been on the back burner that nobody was really talking about. So we decided to elevate the conversation. So in the fall of last year, actually in the summer of last year, we really started putting together this kinship brief that you see on the left-hand side. And I'll say that we have links to all of this at the end of the presentation, so you all can look at the study and the brief in more detail. But we came together, this group, and started working on this brief and included an infographic as part of that. And you'll see that in the middle. And you all may be experiencing this too, but we've come to really realize and appreciate how powerful infographics are in order to condense and consolidate really complicated information in a quick and easy to read way. So we put this together in the summer. We presented it in the fall at a series of regional kinship summits where we had our Department of Social Services staff, other community organizations that were working with kinship providers, legislators, other policy leaders. we presented this kinship brief and, really tried to get the word out about this work. So fast forwarding to the legislative session, which began in January of this year, there was a bill that was introduced that was really designed to get more information in the hands of kinship care providers about what their options were if they were to take a child. So what did licensing look like for them? What potentially stipends might they be receiving? What other services could be available to them? And so to really push our Department of Social Services to engage those kinship providers. And Representative Josh Putnam, who you see at the picture in front of you, was the lead sponsor of that bill. And he worked very closely and heard from kinship providers that testified at hearings, that contacted his office and the offices of other legislators, and that came to the State House on this particular day, on this picture, for a Kinship Day at the State House, again, to meet with their legislators, to talk about some of the challenges they were facing and why this bill was so important. Not long after this, there was, that bill was passed and has now gone into effect. So another really good example of how we were able to take research and data, translate it into recommendations for our policymakers, to get that back into the hands of folks that were personally impacted and professionally impacted by this issue, and then to get them talking with their legislators so that their legislators could in turn introduce and pass legislation to address this. So this is something we were, again, really happy with the way this turned out, but again, took a lot of time, a lot of effort, and a lot of partners to get to this point. So that's an example from South Carolina, and about some of our current work, and wanted to give Whitney a chance to talk about her current work in North Carolina.
Thanks. So in North Carolina, at NC Child, we focus on a broad range of issues that affect children, so not necessarily relegated primarily to child welfare, but we are trying to make connections to bigger issues through a range of different smaller child-serving issues to get at legislators who might not otherwise be able to support that cause. So one example of that is Medicaid expansion in the state. I don't know how many of you are aware, but North Carolina has not expanded Medicaid eligibility under the Affordable Care Act. And although many states that have expanded care have seen really positive improvements in healthcare enrollment, in infant mortality going down, in the number of people receiving drug abuse treatment going up, we're having trouble, right, getting legislators to get behind that. And so we have really worked to treat this issue in a different way, because when you have a policy with a strong research basis but very little political will, one way to get around that is by discussing that same issue as a solution to various problems, so that decision makers of those various backgrounds may care about one of those smaller related problems and be able to see this issue as a solution to that problem, even when they couldn't see it when it was presented to them on its own. Right? So we've attempted to draw the attention of legislators to Medicaid expansion by first supporting it as closing the coverage gap, right? So we're saying that closing the coverage gap is a policy solution to a variety of social problems that impact children's well-being, rather than saying that Medicaid expansion is, because words matter, right? And all kinds of research has been done that has shown that when things become too politicized, a lot of the time people are unable to look at the issue on its own, outside of its political background. So we see that in a more lighthearted way with some of the late night TV show sketches where they go out on the street and ask people if they supported expanding healthcare, and they might say yes. And then they say, well, do you support Obamacare? And they say, no, I do not. So it's really sort of trying to rebrand the issue of Medicaid expansion into closing the coverage gap, first and foremost. And also because it really puts a focus on the fact that people are left out of our current system. And it reminds you over and over again that not doing anything is leaving those people without some sort of coverage, right? And so we have then tried to tie Medicaid expansion to other issues that we've been working on that already have interest or news relevant to North Carolina. So the first is infant mortality. In North Carolina, there is a perinatal health strategic plan that was recently put in place and that the state is working to implement now that is meant to reduce some of the disparities that we're seeing in infant mortality and also decrease the state's infant mortality rate overall. North Carolina has a higher than the national average infant mortality rate, and a lot of legislators who are pro-life worried about that and felt that that was an important issue to tackle. And so we've tried to really make a connection to Medicaid expansion very strong and clear through research briefs, op-eds, blogs, partner pieces with national organizations on their blogs, getting it really out into the forefront and saying that this is a research issue that is outside of politics. And also, if you care about more babies being born, then one way to affect that is by influencing prenatal health through access to care. Right. And so the picture that you see here is from a brief that we released earlier this year called Giving Birth in North Carolina is Still a Risky Business. And so we took the issue of infant mortality, which NC Child had actually written about last year, and wrapped that back up. And also this year published this brief with additional information on fetal mortality, which is not, abortion, but it's actually after 20 weeks of gestation. So we're talking about like stillbirths. But in North Carolina, it turns out that those occur at nearly the same rate as infant mortality deaths. So we're saying that if you care about infant mortality, then this issue is actually twice as big as you thought it was, and that one way to influence it would be by expanding Medicaid, right? And we just said, by closing the coverage gap. Another issue that we've tied it to recently is the opioid crisis. You guys all are aware of the fact that this country is in the middle of an opioid epidemic and everybody cares about it, right? All of a sudden, that is the hot button issue. Everybody wants to talk about the opioid crisis. And we have tied the issue of closing the coverage gap to the opioid crisis by focusing on the increase in the state's entry into foster care rates that have been steadily going up for several years now, but in the past 5 years or so have just gone astronomically higher. And so we're saying that if you maybe don't care about Medicaid expansion, but you do care about more kids being in foster care, more parents not being able to care for their children, then one way that you could affect that is by supporting a proposal that closes the coverage gap. Because when people have access to healthcare insurance, and they are more likely to get treatment for opioid addiction and rehabilitative services, which then keep kids with their families. Also, we've been doing a series of rural forums that focus on these infant mortality issues, that focus on this foster care issue, that talk about different localized communities' experiences, like rural hospital closings that relate to expanded access to Medicaid and what's happening in the state because so many people are unable to afford health insurance. And the rural forums have been especially effective at getting legislative attention in North Carolina because a lot of the most influential legislators here are from these rural areas. So after we had, the first 2 or 3 where maybe not many legislators would show up, we then had media who started to come, and then they started reporting on the fact that legislators weren't there. And then we had legislators who, came more regularly, right? And so regardless of how you get people in the door, it's important that you do and that you make sure that issues that they otherwise couldn't support publicly, like Medicaid expansion, become issues that are, not viable for them to ignore because it actually becomes a political liability to not care about that thing, right? You have to give an issue relevance by exposing it in various frames, which is what I wrote in your slide. And I don't know if you all are familiar with the frameworks model, but essentially it's that you have to appeal to different mindsets and modes of thinking about an issue than you would to just your own, right? So if a moral frame of Medicaid expansion isn't working, then we then have to tie it to maybe a cost effectiveness frame, right? And we have to say that for business development even, it's bad to not have expanded access to Medicaid because it is having all of these negative outcomes for children who are then going to be our future workforce, right? You have to shift frames to make sure that whoever you are talking to is able to hear you. Can we move to the next slide so Megan can tell us more about South Carolina work?
Thanks, Whitney. I was just thinking, I learn something new every time you talk about your work. And I think for the folks on the phone, you probably, we are all doing this work every day, maybe working on different issues, but there is so much more to be done and so much more to learn. So thanks for sharing that. And I think, like Whitney said, reiterating, there are many different strategies and many different tactics that we can use to really drive policy from research. Like Whitney said, the messaging, the framing is important, and we've linked to that later on in this presentation, but how you talk about the work is absolutely critical. And then those public spaces, getting folks to the table, getting them to talk about it, just getting them in the door and raising the awareness. I heard a great quote a couple of weeks ago about research that, we do a really good job in terms of doing the research, but then it gets published in a journal article, and I think the lifespan is maybe 3 months, which sounds incredibly depressing. But if that's the reality, then it has a very short lifespan, and maybe the only folks that look at it are the people in this field, but we don't really do a good job of getting it back to the community in which we're trying to serve or in which we're working with. So any way you can find a way to get your work back into the community in which you're working, that will give you an opportunity to further elevate your issue and bring on more advocates. So I'm curious, and I would love it, Sarah, if you can help me with this in the chat box or in the question box, to if y'all are familiar or anyone's familiar with results-based accountability or have used it, please share those thoughts with us. If you're familiar with results-based accountability, if you are, how you've used it, and if you're not familiar with it, that's okay too. Would like to know from this group. I'll give everyone a few seconds to type in. Sarah, any responses that you see on your end?
Yeah, we have quite a few people who said not familiar with it, but really looking forward to learning more.
Okay.
Yeah, somebody says, like, I'm kind of familiar, not entirely familiar. So it looks like this is an audience of mostly folks who are unfamiliar, which is great.
Great. All right, well, we'll spend a few minutes talking about this and then leave you with some additional resources and some next steps as we wrap up today. So results-based accountability is basically, I think, a sort of a fancy way of saying you're going to use data to drive strategies. I think oftentimes what we end up doing is we start with the strategy, or we start with the issue that we want to work on, and then we back into it with the data. Results-based accountability has us do it the other way. So we look at the data, decide what really is the data telling us, and then what is the ultimate result that we want? So what do we really want to achieve? And then what strategies align with that? And really being truthful and honest about whether or not those strategies are going to drive to a result. Sometimes we like to do work because we think it's fun, or we just enjoy doing it, or it maybe feels like the right thing to do. But in reality, that strategy is not going to get us to the end result. So one of the ways that we've been using this, and this is a relatively new group that has come together in South Carolina, is around permanency. So we are trying to capitalize on some current issues, like Whitney mentioned in North Carolina, really capitalizing on what are people talking about and how can we tie it in. We have a lawsuit in South Carolina for our Department of Social Services, and we're really, they're looking at how children in foster care are receiving services, and the fact that we have so many kids in foster care that continue to stay and don't get to permanency. So they don't get adopted, or they don't get reunified with their families. So we came together with a series of partners of ours, several partners of ours, and have done a series of meetings around permanency. What you see on the wall is data. And this is something I think Whitney mentioned in one of her comments, was about doing a data walk, which is actually, I was a little skeptical at first, but it's actually a really interesting and effective way to get people looking and talking about data, and just instead of just a generic presentation or PowerPoint. But we took permanency data for South Carolina. We looked at how long are kids staying in care, how old are they, what areas of the state are they living in. Put all of that up on big poster paper on the wall and had our providers walk around the room for 15 minutes and look at the data. And that's what you see in the top picture. So they had a chance to look, ask questions, make comments, and then we got back together and had a much bigger group discussion about it and decide that we, as this group of providers, really want to ensure kids are getting to permanency within 12 months of them entering foster care. And so that then required another series of conversations about, well, what are each organization's contributions going to be? So some groups said, we really want to focus on staffing and training our staff about how to look at cases and identify caregivers for the kids that are in care with us. Other groups said, we really want to look at legislation. We want to drive policy that will help to fund some permanency initiatives. And the list goes on. But we kept asking, and we continue to ask those organizations 3 key questions. So as you're looking at measuring our work and determining if we're effective, we have to ask ourselves, how much did we do? How well did we do? And is anyone better off? Because if we can't answer those with data, then we can't really measure how our work is making an impact. So this group has been meeting since December. We're now in May. We continue to work on this. And I'm going to give you a little bit more information about RBA as we wrap up and what are our next steps. So next slide, if you don't mind, Sarah. So Whitney, please jump in as we talk about these recommendations, but practice is absolutely critical to this work. We're going to tell a secret. Can't tell anyone else on this call. But policy really isn't that hard, truth be told. I think some things are probably way more difficult, but it does require good communication, strategy, good relationships, and good timing. But if you really get down to it, it's really not that complicated, and people can do this work and should be doing this work. Just a couple key things to keep in mind. Keep your talking points brief. If you can't say it in 30 seconds or maybe a little over 30 seconds, practice it until you can. Like Whitney said, think about those messaging points. Find different ways.
Can I just add to that?
Yeah.
Oh, sorry.
No,
so
go ahead.
Not only being able to say it in 30 seconds because it requires you to understand your issue more thoroughly, right? Because it's hard to explain something simply when you don't know it that well. But being able to say it in a short period of time, because you often don't have that much time with people where you can make that impression. And that even when you do, people are going to remember like the touch points that you present to them. So breaking down a really complicated issue into its most salient points is probably the most important part of your policy work, especially with you guys having the research background that you do, being able to remember that the research is important, but you're never going to be able to get an audience where everyone is going to both understand the research and care about the policy impacts, right? So you need to be able to do that before you talk to them.
Absolutely. And that sort of goes to the third point about speaking to the heart, using the brain, and vice versa. So it really, if you are, if you're engaging with someone, and you'll get to know legislators or policymakers in this space who they really lean towards the data and the facts, and they want the cost analysis and the fiscal impact, and then others really want to speak to it as as an issue they care about because they're a grandparent or they're a parent. That you have to really sort of tailor that and often realize that you, in fact, may not be the best messenger for that particular issue, and that it may require bringing in someone else, or that you can complement each other. You can speak to the data, the research, that piece of it, and you need someone that can sort of play to that emotional side of it. So keep that in mind.
And that also reaches back to the point that Megan made earlier about not wanting to take credit for things. That also comes in a lot in this type of work when it comes to finding trusted messengers, because if you realize that you are not that messenger, they don't always necessarily, whoever it is you bring in, know the issue better than you, but they are someone that other people find it easier to hear that message from, right? So you need to be willing to distill whatever research you have found on that issue into talking points for someone else and not need to get that credit yourself, and to focus more on the goal than how you get there.
Absolutely. I think it's important to develop key close relationships with at least one legislator and one maybe policy person, someone that has a different area of expertise than you, to be your sounding board. And it's even better if you have differing opinions about sides of the issue, or just generally may not be someone that you would sort of agree upon from a political side. To be able to sit down and have a conversation with someone about, and really not even pitching to them, but just asking them what they think about a particular issue, what's important to them, what would make them vote on a particular bill around whatever issue, maternal mortality or infant mortality rates, whatever the issue may be. But just sort of getting to know them a little bit better so that you can better understand where they're coming from, and then hopefully, and maybe at some point, develop an ally that's not someone that you would maybe expect to have as an ally, that can really go to bat for you and can help bring other people on that they may identify with or have similar opinions with, that say, well, if this legislator thinks this is a good issue, then this is probably something I should pay attention to as well.
Right.
And the last thing before we get to the homework, because of course we have to have homework as we close out, is that don't get discouraged. This is a marathon, and it does take years to pass good legislation. Sometimes that even means that you get to a point where you have a bill that's almost to the finish line, and you have to work against that bill passing because it's been amended or it's been revised so many times. It's really not what you wanted, or it's not going to be good legislation, and it's going to have unintended consequences on the population you're trying to serve. So don't get discouraged. That does happen, but it does require a lot of, like I said, a lot of time, a lot of people working on it, and make sure you celebrate the small wins, because even just getting a committee hearing on a bill, or getting a legislator to say, yes, I'm interested in this and I would like to support or sponsor some legislation, those are the wins that need to be celebrated, and they will keep you going as you continue the work. So don't get discouraged, but again, sort of find ways to celebrate the work as you go. So the last slide I have, go ahead, what's Whitney?
I was just saying, could not agree more.
Yeah.
You have to think some whole years are foundational years, and that is fine.
Right, absolutely. So this is our homework, our last closing slide before we get to some resources and then any other questions that you all have, is familiarize yourself with results-based accountability. If you have not read the book by Mark Friedman, Trying Hard is Not Good Enough, this is the book to read. It is the best description of what results-based accountability is, and it provides some really easy to use and understand tools that you can apply to your work. So how to go about conducting a data walk, how to go about identifying your strategies or your results. This is the book to pick up and read, because it will help ensure that the work that you're doing is really driven by the data, and we're not driving a result that we haven't first looked at. Well, why are we even caring about this issue? What is the data really telling us? If we want to be strong in results-based. Yeah, go ahead.
I was just going to add that it also has some really practical tools that help you to hold more effective meetings, to make sure that you have the data that you need to get started right. So RBA work has completely transformed the way that I look at how meetings should run, right? Because it helps you to break down everything into a very certain period of time for each aspect of a meeting, and then to remind you of what everyone is supposed to be getting out of that portion of the meeting. And so when you start doing all of your work that way, then it's a lot easier to have the sort of data driving your strategies that you're going to need, because all of your strategizing is much more effective.
Yes. And I will say, Annie Casey Foundation, I was a fellow of theirs a couple of years ago, and they use the state-based leadership advocates program that they have. It's based around RBA. So you can look at Annie Casey to see of real examples of organizations and communities, even local governments, how they're using RBA and what that really looks like in a practical, real-world application. I would also, Whitney's mentioned it, Frameworks Institute, to check that out as well. It will really help with messaging and coming at our issues from a different viewpoint, a different frame, in order to be as effective as we possibly can in communication. Y'all know there's a lot of issues out there. They're all incredibly important. And so we really have to think about that as we're competing for limited time and resource of legislators and policymakers. Our session ends this week. So if the bills haven't gotten through or passed at this point, we'll have to start over in January. So we want to make the most use of our time that we have, and good, effective communication is the way to do it. The other thing that I would say is get to know your legislators. So if you do not know who your personal legislators are at a state and or federal level, please do that. Go online. Our State House website has a great tool to find out who that is. And then engage in the legislative process in whatever way that looks. Either sit in on committee hearings. In South Carolina, you can go sit in and view the committee hearings and the floor debates. You can even watch it online, but get to know your legislators and know what they're talking about and what issues are important to them. And then you can find ways to build a relationship with them and interject the issues that you're working on as you get to know them a little bit better. Whitney, is there anything you would add to that?
No, just that sort of involvement is also here in North Carolina. You can sit in on committee meetings, you can sit in on sessions, and a lot of people don't do that if they aren't directly connected to the work. But that is a way that you can really get grounded in a lot of these issues quickly and easily by just sitting in front of the people who are making these decisions and hearing them kind of talk it out amongst themselves. It doesn't all have to be, theoretical work.
Absolutely. So obviously identify who your key partners are, find them. They hopefully are moving towards action and are aligned with your work. And you'll learn more about high action, high alignment in the RBA book that you're going to read. And then just determine what your role is. There's no way that everybody can be good at everything. So you have to pick your strengths and then bring on those partners that can support you in your work. I know that we're at time, but I do want to make sure we've got time for any questions. We have a list of our resources and links for additional information, and would be curious to hear what comments or questions you all have before we close out today.
Thank you so much for this really wonderful information, Megan and Whitney. A question came in, which I'll paraphrase. You discussed on slide 9 needing to sometimes connect an issue that you're passionate with to a different issue in order to generate the political will or interest in it to get it passed. As researchers who are focusing on specializing in one area, what advice do you have for keeping your eyes and ears open about other issues and making sure that you know enough about other issues to be able to connect the issues that you care about to other things in order to get them, to get folks interested in them?
Sure. So that's a really good question. I would say, first off, just like when you're a kid, you got to read, right? So reading not only academic publications, but reading the local news, I think more than anything else gives you an idea of what issues everyday people who might not have heard about your research are thinking about and what things they are focused on, because all of those issues are not necessarily going to show up and appear to you as something that is directly related to what it is that you're already doing, right? But you have to think outside of the box, and RBA will help you some with that, but also in frameworks, if you guys do your homework, they'll help you some to think just a little bit bigger. A lot of time it's not so much a difficulty in understanding those other issues as it is in finding a way to connect them to your work. So, I mean, just reading the news, talking to people in your family, people outside of your work, people in your friend group who, don't work in the same area as you, can let you know when there is like a cultural pulse on a certain issue, right? But it's really the hard part in coming up with that thread that ties those things to your larger work. So for us, it's, closing the coverage gap, but it's all we're hearing and seeing in the local news and on TV is people talking about the opioid crisis. And we had to think, okay, how is that related to this issue? How can we make this in something that that people care about, right? Because those things are related, but a lot of people just don't see them that way. And so it's more about knowing what people are up to than anything else. Megan, do you have any ideas on that?
Yeah, I would add to that, networking is it, right? So there's a version of Children's Trust in every state. Whitney and I, there's associations like ours in every state. To find out who those are and get on their listservs, start reading their policy newsletters if they have them, take a look at their legislative agendas. Oftentimes policymakers put out, here's what's happening at the State House this week, or a quick recap, and you can hear about what they're talking. Again, sit in those legislative hearings, and I can't tell you how many times I've been in there and sort of I had an aha moment of like, gosh, I never really thought about this, but this is obviously an issue that these legislators are caring about, and it's connected to our work. So how do we tie the two together? And thinking about that, like Whitney said, that's a difficult part. That's the trial and error part where you're going to say, gosh, that message really didn't work, or we're going to get lost in this this bigger issue, so we need to sort of pull back a little bit. So that takes some finesse, but just sort of cast a wide net and figure out who do I need to network with, and especially not just people that you agree with, but oftentimes I go look at organizations where I don't agree with them politically. Their work is not necessarily aligned with us, but I still want to hear what they're talking about, and so I want to get on their listserv and just see what's bubbling up. So that if there is an opportunity, and again, timing is everything, if there's an opportunity to interject that, then we're ready. That's a great question.
We don't have any other questions that came in, but a few comments came in just saying like, thank you, this was so informative, and a lot of smiley face emojis. So I'm taking that as a win. Thank you so much, Whitney and Megan, for facilitating the webinar. Really appreciate your time, and thanks to everybody who joined us virtually here. It was great to be with you all for an hour virtually. And I will share a recording and slides, Whitney and Megan, if you're comfortable with that, with all participants.
Absolutely, and please, we've got our email addresses on there. We'd love to hear from you as you're going through your journey and have any other questions or challenges along the way. We'd be more than happy to talk to you.
Yes, happy to be resources.
Thank you both so much. And thanks, everybody. Yeah. Have a great rest
of the day. Thanks for having us.
Thank you.
Bye.
Bye-bye.
Bye.